most of the people, what they miss is they don't give importance to the sperm. What importance they give to a woman in a fertility, what importance they give to the egg, they don't give it to the sperm. But then 50% of the embryo is from the sperm also.
Hello everyone, I welcome you all to yet another discussion of Dr. Story. In vitro fertilization or IVF, a medical procedure wherein an egg is fertilized by sperm in a test tube or elsewhere outside the body. 1 in every 8 heterosexual couples have difficulty in conceiving, plus homosexual couples and single parents too need clinical help. This treatment brings hope to all those couples unable to conceive naturally. However, following IVF treatment, at times there might be a failure of the embryo to implant onto the side of the uterus wall. This failure is called as repeated implantation failure. To detail us about the same, we have invited Dr. Nivedita, a young, enthusiastic gynecologist with her interest in reproductive medicine and fertility-enhancing endoscopic surgeries. Her dedication and passion towards reproductive medicine and such surgeries made her pursue a fellowship in reproductive medicine at OSHREM, Oasis School of Human Embryology and Reproductive Medicine. And later, she did her fellowship in minimal access surgery from World Laparoscopic Hospital, Gurgaon. She is a member of Royal College of Obstetrics and Gynecology, London, and is currently working as a consultant fertility specialist at the Hive Fertility Clinic, amassing more than 11 years of experience. Dr. Nivedita, a warm welcome to Dr. Story.
Hello, thank you, Anshul. I'm happy to be here with you today.
So, Doctor, I have briefed our viewers with repeated implantation failure. However, if from a doctor coming from you, you could elaborate more on the basic understanding what is repeated implantation failure.
Definitely. So, repeated implantation failure, what it is usually in an IVF cycle, we have a particular number of embryos which we transfer in that cycle. So, according to the latest definition, when 2 good grade embryos are put into the uterus of a couple and they fail to implant, we can take it as a repeated implantation failure. In previous times, they used to have that number as 4, 5. To be precise, there was no proper definition for a repeated implantation failure. Like 2 failed IVF cycles, 4 good quality embryos. There were multiple definitions for repeated implantation failure. But right now at our institution, we follow a protocol where we have put back 2 good embryos into the uterus. They have failed to implant. Then we take it as a case of recurrent implantation failure and then try to find out what was the reason and do something better to the patient.
Okay. So, how common is repeated implantation failure? How often do you come across this?
Okay. See, generally when 10 couple are going in for an IVF cycle, based on the reason for the IVF which we have opted them, they can have a success rate ranging between 60 to 70% in our center. Okay. So, which means in single IVF cycle, 3 to 4 couple out of 10 end up not having a successful result. So when we do them again with the second IVF cycle, another 50% of this 3 or 4 get pregnant, which means the last 1 or 2 will be coming under the category of repeated implantation failure. So in general, we can consider a 10 to 20% risk. But again, you know, this is not a fixed incidence. It depends on the reason for which the IVF was opted. Okay, for some reasons the success is better, and for some problems there are more incidences of repeated implantation failure. So based on the problem for which we do IVF for the couple, this incidence actually varies.
As you said, there are different reasons to it, but what are the signs that there is an implantation failure?
Okay, see, usually after an IVF embryo transfer, we do a pregnancy test for the couple after somewhere between 12 to 15 days, depending on the day of embryo transfer. So once that result turns out to be positive, we consider an implantation has happened. But then if the result turns out to be negative, we understand there is an implantation failure in that particular cycle. Okay. So depending on the number and the grade of embryos, if the first cycle itself there were 2 good quality embryos, we then start working them up for recurrent implantation failure as to why it has happened. But if the first cycle the embryos were not very great, or they didn't have good quality embryos, or we only did a single embryo transfer, we again do a repeat embryo transfer and see how the outcome is, and then we come to a conclusion they have a recurrent implantation failure, and then start working them up for the same. That's how we diagnose it.
What happens when the implantation fails? Are there any symptoms on the body, or we see what is the consequence when the implantation is failed?
Yeah, that's the most burning question for a patient who has had an IVF failure, because they invest so much into the process. Like a lot of emotional factor is there in our country, especially a lot of financial factor is there, because in Western countries insurance supports most of the procedures, whereas in India we don't have those facilities. And then a lot of they also go through some amount of pain, like daily injections, break from work, coming to the hospital. So there is a lot which they put into this IVF failure. So once it becomes a negative, once an implantation failure happens, it's a very difficult situation for the patient as well as for the clinician, because for us also we are responsible to give them the result, right? So the main consequence I would tell is the emotional thing. First, you have to get out of that failure and then think of what next would be the better. So they will need a lot of motivation, psychological counseling to make them feel better mentally at first. And once they are mentally better from this failure, then we discuss with them what all we did and what could we do to make it better. Okay, so that's how we approach a patient. First, we make them comfortable. We at the first visit when they have a failure, we don't give them all the options, because they are not even in a mental state to take it on. Just now they had a failure. So first we have to comfort them emotionally, give them a psychological counseling, make them feel better, because an IVF success is only 60 to 70%. And then once they are comfortable, we give them the options as to why it happened and what can be done better. Okay, so coming to the counseling, like what to be done better for an implantation failure. 80% in an IVF cycle, the success depends on the embryo. Embryo is what we get by taking the egg, taking the sperm, doing the ICSI, and out of which we get the embryo, which we grow in the lab till a 5-day stage, give it a morphological external grading as to grade 1, grade 2, grade 3 based on the appearance, and then we transfer it into the uterus. So 80% of the time, if this embryo is good, we end up having a good result. So in simple terms for the patient to understand, we compare this embryo to a seed. 20% of the success depends on the endometrium. Endometrium is actually a lining which is present inside the uterus. For the embryo to be transferred into the uterus, we prepare the uterus with certain medicines. We do serial scans to understand whether the uterus is ready to receive the embryo. We see quite some things on the scan, and then when we are convinced everything looks fine, we transfer the embryo at a particular time. Based on some calculations, we transfer the embryo into the uterus. So 20% of the success depends on the uterus. Say uterus is compared to a soil. 80% if the seed is good, it will grow. But 20% the soil is also important for it to grow. So when this doesn't work out, going back, what to be done next? There are 2 options. Okay, so one is improving the embryo quality. Okay, 80% we have to improve the embryo quality to get a better result, and 20% we have to see why it failed in this endometrium. So when, in terms of the embryo quality, we go back and check for the couple's egg quality, whether there was any issues in the egg quality and what caused those issues and how improvement can be, because egg quality is something which is determined by genetics to 50 to 60%, and another 30 to 40% lifestyle, diabetes control, hypertension, other problems can also affect the egg quality. So we go back and have a checklist to check whether all this was fine and whether anything could be improved in it. And a little can be done by using some injections which are like growth hormone, recombinant hormones, because there are several injections in the IVF cycle. There are recombinant injections, there are biosimilars, which are not recombinants, but they work like recombinants. So we go back and check on the protocol as to what injection this patient has received, whether anything can be done better in it to improve the egg quality. Then again, most of the people, what they miss is they don't give importance to the sperm. What importance they give to a woman in a fertility, what importance they give to the egg, they don't give it to the sperm. But then 50% of the embryo is from the sperm also. So we again go back to the male partner also and check for lifestyle issues, obesity, those problems. And then generally we do a basic semen analysis, which gives us only details about the sperm count, motility and morphology. There is an entity called the DNA fragmentation index, which tells us how much the DNA is damaged within the sperm, which we usually don't check in any of the basic tests. So we advise the couple to do a DNA fragmentation index, and then combining all these results, we give them a better protocol, which might marginally improve the quality of the embryo. And coming to the endometrium, there is one advanced test called ERA, endometrial receptivity array, which tells us like a day 5 embryo transfer usually happens approximately around 121 hours after the start of a hormone called progesterone. So this is what is universally followed in most of the sectors. But then for people with recurrent implantation failure, they have found out scientifically that at least for 50% of the patients, this window of implantation, that timing actually varies. It's an individualized timing is what they tell. So by sending this endometrium for genetic testing, we check for almost 238 genes, whether whatever is needed for implantation is present at that time in the uterus of that particular individual. So based on this result, they give us a personalized time. Say for this patient, whatever timing you have done was right, but for this patient, you have to do it a little later, a little earlier. We get a personalized timing like that. So basically, when we do ERA test and follow the timing to do the embryo transfer, we do get very good results for these kind of patients.
Right, so I think we have elaborated more on how we stop recurrent implantation failure now. We also mentioned something of what is embryo biopsy and does it improve success rate?
Okay, yeah, embryo biopsy is, see, as I told you, 80% the embryo quality should be good for a embryo to implant and grow. But then whatever grading we are giving to the embryo is by the external appearance. Like we see the embryo and tell it's good, it's not good, okay? But for it to implant and grow, genetically the embryo needs to be normal. The genetic content of the embryo we don't see in a morphological grading, okay? That's when this embryo biopsy comes into a play, where we take 2 to 3 cells of that embryo and send for a genetic testing. And in that genetic testing, we get a result of which embryo is euploid. The problem is in humans, the aneuploid rate is high, which means genetically abnormal embryos are higher. Say if a couple have 6 embryos or 8 embryos, genetically normal will only be 50% in the age limit of 25 to 30. So which means only 3 or 4 embryos are normal. For some couple with recurrent implantation failure, that aneuploidy rate can be high. So in those couples, we do the genetic testing of the embryo and find out the euploid embryo. And then when we put it back into the uterus, our results are much better. It's similar to a biopsy on the endometrium, ERA. We do a biopsy on the embryo also. It's called pre-implantation genetic screening, PGS.
Thank you so much for that elaboration. And also, if you could help us understand any condition where an IVF fails even after implantation.
Yeah, see what it is once the implantation happens, okay, it means the pregnancy has happened. Then we call the patient for serial consultations to see how the pregnancy is progressing, okay. Generally, 90% of the time, the pregnancy progresses in a healthy fashion. But sometimes in 10% of the couples, see 1 out of 10 people, even after pregnancy happens, they can have bleeding. they can have miscarriages, they can have abortions. All this also happens. But then that will not come into the criteria of recurrent implantation failure. It is a pregnancy loss. Okay. And when it happens repeatedly, more than one time, we call it recurrent pregnancy loss, and then manage those patients based on the recurrent pregnancy loss. What should be done? We do.
Finally, what would you advise to a couple who is facing repeated implantation failure?
Okay, so first of all, they have to be very, very strong. Okay, because once they are into this journey of trying, they have to keep trying. They should never give up. That is what is going to fetch them the result. Okay, then they should have a very open discussion with whoever they are following up with to understand what could have gone wrong. Okay, and they have to sit and analyze their test to understand what all could have gone wrong and where they can improve it. And generally, we advise a healthy lifestyle, good peaceful 8 hours sleep, and then good diet, exercise, all this for the patients who are facing these issues. Because sometimes even after an IVF failure, with all these lifestyle measures, when they are relaxed, there are people who come up with a natural pregnancy. So you just always have to have that positive hope in you that pregnancy will definitely happen. But in turn, most of the patients feel devastated. They completely lose hope. They think this is never going to happen to me. That should not be the thought process, because at least 5% of the patients, which means 5 out of 100 couples who have an IVF failure, do have a natural conception, which means they don't even have to go through all these tests. They don't even have to go through another IVF cycle. Just by being positive, they can achieve that natural pregnancy also. So first thing we would advise is never lose hope. Try to understand logically what could have gone wrong. And then the common things which people ask is, Madam, I was not in complete bed after the IVF. I walked around. Was that the reason for failure? To be frank, scientifically, there is nothing like that. You can be as normal as possible after an IVF cycle. And if everything was normal, the implantation will happen. By being in rest, you're not improving the chances of implantation. So people have that misconception. First cycle, I was working. So second IVF cycle, they are bedridden, which will not improve their outcome. Okay, when you're active only, the outcome is going to be better, and this is scientifically proven. So we should approach it in a very logical way. Okay, and beyond all this logical thinking and logical actions, we should understand only 70 to 80% is in our hands. Another 20%, we have to leave it to God Almighty and pray for the success. That's all we advise our patients.
Well, thank you so much for helping us with this advice. It's a great point of advice and understanding this condition so deeply. And we truly appreciate and thank you for joining in.
Thank you, Anshu. The questions were very elaborate and very nicely you took the interview. So thank you so much.